Democrats are not giving in on the shutdown stalemate. They say it is worth it to restore the bigger health care subsidies that a lot of Americans rely on. But some states are warning that it's already too late to do anything. Open enrollment is just weeks away, and it takes time to update those state systems when changes happen. And that could have a huge impact. The Kaiser Family Foundation found that if those subsidies are not extended, premium payments for ACA plans would more than double on average. With me tonight, Julie Rovner, Chief Washington Correspondent for KFF Health News and host of the What the Health podcast. Julie, thank you so much. I love your podcast. I listen to it all the time. It's really a great way to nerd out for those who follow healthcare issues. Republicans are saying that Democrats should agree to reopen the government now and wait to negotiate over those Obamacare subsidies until the end of the calendar year. Why might that not work? Nerd out with me.
I will nerd out with you. As you alluded to earlier, in Idaho, open enrollment has already begun. So people are already starting to sign up for health plans. In a number of states, we're seeing what's called window shopping. So people are seeing what their premiums are going to be without these enhanced premium subsidies. And a lot of people are just going to take one look, say, I can't afford that. And even if eventually Congress decides that they are going to continue these expanded tax credits, those people may not come back. They may have taken one look and said, I can't pay that much, and that will be it. So every day that passes makes it more difficult for these states to, make these changes if the tax credits are continued, and it makes it more likely that people will see that they can't afford it and go off and do other things.
And it's not just the people who would be getting subsidies who are affected by all of this, right? So it's not just like lower income or middle income people whose health premiums might be more expensive as a result of this policy, of these subsidies lapsing. There's a bigger universe of people. Can you explain the ripple effects that the expiration of these subsidies would have?
Yes, because when you have more people who don't have health insurance, those people eventually get sick. They go to the doctor, they go to the hospital, and it becomes charity care, what we call uncompensated care. That cost gets passed on to people who do have insurance. So insurance gets more expensive for the people who are able to have it. That's one of the things the Congressional Budget Office said in its estimate of how much it would cost for these subsidies to go away, because they are building in the extra cost for people who will become uninsured because they can no longer afford health insurance.
And let's talk about who actually uses these plans. These are people who make too much money to qualify for Medicaid, but they can't access or afford other insurance through an employer, for example. KFF found that we're talking about landscapers, chiropractors, freelancers, farmers, real estate brokers. This matters to a really broad group of Americans, right?
Oh, absolutely. And, it's funny, when the Affordable Care Act passed, the thought was that the individual mandate, the requirement that people have insurance, was going to bring more people in because they didn't want to pay the extra taxes. That didn't work that well, as it turned out, and it was repealed in 2017. But what did do the trick was making those premiums really affordable, and that's what those enhanced premiums did. And we saw enrollment in Affordable Care Act plans double after those tax credits were increased, from about 12 million to about 24 million people. And those 24 million, as you point out, a lot of these people are self-employed. They're farmers and ranchers. They're small business owners. They're many of them Republicans. I mean, that's the big irony here, is the Democrats are fighting hard to basically save health insurance for a pretty Republican group of people.
Yeah, I was just going to ask about that. Something like 6 in 10 ACA recipients live in congressional districts that are represented by Republicans. I mean, as has been exhaustively reported, last week Marjorie Taylor Greene said her own adult children's insurance premiums for 2026 are going to double, along with families in her district. How does that affect the politics here?
Well, that's why the politics are so ironic right now. When Republicans find this out, who knows who they're going to blame? But if Democrats win, it will help Republicans probably in the midterms because we will have fewer people who are going to lose their health insurance. Just everything you were talking about in the last segment with costs going up. We'll see how this all eventually shakes out. Democrats have decided that it's more important that people be able to keep their health insurance, even if those people may have voted Republican in the last election.